But okay, good evening, everyone. Thank you very much, Wahida. It is actually a privilege and honor to be here with you people today, and I must congratulate the the finalists, the schools that have made it up to this point, and to a great extent, I also want to extend gratitude and congratulations to the organizers. It's not easy to organize a program like this. So, and the program has been going smoothly since the preliminary stages up to this final. Final was supposed to be held on Wednesday last week, or was it Monday last week? But because of the election in Tanzania, we decided to shift it up to this one. Who's Daniel? Daniel, please, can you mute yourself? And Daniel, please, who's Daniel? Daniel,
So,
who's Daniel? Which MSA is Daniel? Okay, sorry about that. Without wasting much time, we start with general knowledge. But from what I'm seeing here, it's only 5 schools that are present here. Abumsa, Kumsa from Uganda, Lasumsa, and Oumsa. I can't see Tamsa, St. Francis. And Tamsa is from Tanzania, so I can't see Tamsa there. Please, Wahida, can you put on your group chat for the participants that they should, um, the Tamsa team should join the quiz, please. Or any of the participants here in other MSAs can just put on the group chat that FAMSA is not here so that they can join, please. Wahida, can you hear me?
I can
Wahida,
hear you.
yes,
Yes.
please. Is there a way we can reach out to TAMSA? This is finals, so, and I don't think they would like to miss the final. I don't think any school that made it up to this stage would like to miss the final. Please, can we try to reach out to any of them?
Please, let me contact them.
Thank you. Also, do we have okay, I can see the score recorder. Do we have the timekeeper here? Do you have the moderator here? Wahida, I believe Wahida, are you going to be the moderator, or did you assign that to somebody else? Who is Aisha Abubakar?
She's a FAMSA secretary, FAMSA general secretary.
Oh, okay. Okay, you're welcome. Wahida, is it possible for us to unmute only the participants of the quiz so that any other person that joins cannot unmute itself? Is it possible we do that?
I think they can mute the participant who want to join, they can mute themselves. And if there is any interruption like in between, then we host and co-host, we can mute them
Okay.
during the
All right.
process.
Okay, that's good. So that means general people, anybody can join the quiz, but they cannot say anything. They cannot unmute, right?
Yes. So I've contacted the TAMSA. They said like they confused the time. But now I told them to join right now.
Okay, thank you very much for that.
Excuse me, Quizmaster.
Okay, Kumsa, I can hear you.
Yes, Quizmaster, we are just concerned and we are wondering why other people need to join the quiz other than just the participant MSAs.
Do you have a
Yeah, I
reason
thought
for
they
that?
are following from YouTube. They don't need to join this meeting.
Do you have a reason for that? Kumsa, do you have a reason for that? Kumsa, do you have a reason for that?
Can you hear me, Mr. Quizmaster?
Yes, I can hear you. I was asking, do you have a
Hello?
reason for that? All right. So once it is 6:20, we start. I can see Tansa Souza here. So we have Kumsa, we have Kumsa from Calabar, Kumsa from Uganda, we have Abumsa, we have Lasumsa, we have Omsa and Tansa Souza. So Kumsa from Uganda, please can you mute yourself? Thank you. Wahida, do you have the score recorder here?
Yes, we have a school recorder,
What about the
and I'll be the
timekeeper?
timekeeper. Our host, Elton, please, can you please be a timekeeper for today, right? You are the timekeeper, right?
Okay, so I'll be sharing my screen. I believe that having gotten up to this stage, it's no longer something new. We are used to the rules. Okay, unless there is any changes, we let you know before a particular section. So just like before, we will be having 4 sections. We'll be starting with the general knowledge, followed by the preclinical section, then this clinical section, and finally maths and logic. So our rules generally remains the same. Okay, but there's always an addition to the rules whenever I'm the quiz master, and the addition is very simple. The addition is this: if you answer a question and you are not 100% sure of your answer, please don't contest the question. When we say you failed the question, please don't contest. Don't say, oh, what is the source, or we should like don't contest the question, the answer or the question. But if you are 100% sure, that's the only time you can contest. Then the thing there is, if you are not 100% sure and you contest the question, and after spending our time to verify the answer, and you are wrong, we are going to subtract 5 marks from you. That has always been the rule. So before you contest a particular answer or a particular question, please take note of this. All right, I'll be sharing my screen now. Let me check again. The participants are all available. They're all around now. We have Abumsa, Kumsa from Calabar, Kumsa from Uganda, Lasumsa, Omsa. I can't see okay, 1, 2, 3, 4, 5. One school is missing. Tamsa has gone offline again. Habiba, are you from Tamsa? Okay, Tamsa is back. All right, let me share my screen. Can you see my screen now? Can you see my screen now? Wahida, can you see my screen?
Yes, I can see. Yes, I can see your screen.
Participants, can you see my screen? Okay, Wahida, please, the order that you have on your list, please, can I have the order? Which school is first on your list? Wahida, please, can you unmute yourself? Which school is the first on the list?
Yes. So the first school is, let me check. So we are going to start with Calabar University MSA.
Okay, just give me the
That-
list. Calabar University, which one? What's next?
Next is Lagos, followed
Lasumsa,
by Ahmad. Yes.
Abumsa, what
Followed
else? What's next?
followed by Ahmadu Bello University.
Followed by,
Ahmadu Bello University.
yes, followed by,
Kabale University.
sorry,
Kabale University.
Kabali, followed by,
Tamsa
Tamsa,
State
followed by,
Olabisi Onabanjo University.
Olabisi Olabanjo University. Okay, thank you very much. So the order is this. For the first round, we move from Kumsa, Asumsa, Abumsa, Kumsa from Uganda, Tamsa, and Omsa. For the second round, we start from down up. I always advise participants to always have your own score recording. Me, I have my own, but we have the general score recorder that will give us the answer, the scores at the end, just in case. So please, we start with Kumsa. Our rules remain the same. So we have for the general knowledge section, we have, can you hear me? For the general knowledge section, we have from question 1 to question 35. So each question is going to, we have 10 seconds to answer each question in preclinicals, in general knowledge. So we start with Calabar. Calabar, pick your question.
Question 6.
Calabar, question 6. Who is known as the father of genetics?
Gregory Mendel.
Grigo
Mendel.
Mendel is very correct. You have 5 points. Kumsa. Lasumsa, please pick your question.
Question 7.
Question 7. Which country is the only one in the world to lie on both the equator and Tropic of Capricorn?
Which one is it? 10 seconds.
Kenya.
Kenya. Is that a final answer?
Yes, yes.
I don't think so. Kenya is wrong. It's Brazil. You have 0 points, Lasumsa. Abumsa, pick your question.
8.
Question 8. Sorry, this question is out. Question 8. The Bretton Woods Conference of 1944 led to formation of which two major global institutions?
It's about money or conversion of
We don't have time, just talk.
to gold.
Okay.
I don't know the
International Monetary Fund and the World Bank.
World Bank and International Monetary Fund. I think that's very correct. World Bank and International Monetary Fund is very correct. You have 5 points, Abumsa. Kumsa, Uganda, pick your question.
Number 2. Question 2. Question 2.
Question what?
Number 2.
Question 2.
Question number 2. Which
Yes.
African country was formerly known as Abyssinia?
Ethiopia.
Ethiopia.
Is that a final answer?
Yes.
Ethiopia is very correct. You have 5 points, Kumsa. Then, Tamsa St. Francis, please pick your question. Tamsa St. Francis. Tamsa Souza, please pick your question. I don't think Tamsa can hear me because they are not unmuting themselves.
Number
Tamsa,
5.
pick
Question
your
number
question.
5.
Okay.
We
Number
have already
5.
unmuted ourselves.
Which
Say number
part
5.
which
Number
part
5.
of the human body
Yeah.
contains the smallest bones? Which part of the human body contains the
Ear.
smallest bone?
It's
Ear. Yeah, that's correct.
ear.
Ear is correct. You have 5 points, Tamsa Souza. Olabisi Onabanjo
Ear.
University. It's correct. You have 5 points.
Question 4.
Sir, please pick your question.
Question 4.
Question 4.
Yes.
Which is the world's strongest currency as of now, 2025?
United States dollar. You dirham. Ah, 4. I don't Saudi. Saudi Arabian dirham. No.
Saudi Arabia, is that your final answer?
United States dollar. United States dollar.
Is that a final answer? That's wrong. It's Diana of Kuwait. Diana of Kuwait. That's
Time is up.
You have 0 points. Thank you very much, M Score Recorder. So we've come to the end of the first round. So for the second round, we'll be starting from Ounsa. So Ounsa, please pick your question. Ounsa, please pick your question.
Question 3.
Question 3.
Question 3.
Yes.
Which country hosted the first modern Olympic Games?
Greece.
Greece is correct.
Yes.
Yes, they hosted both the modern and the ancient Olympic Games, so don't be deceived. It's both modern and ancient. The difference is the city. For the ancient Olympic game, it was hosted in Olympia, while for the modern Olympic game, it was hosted in Athens. So you have 5 points. Tamsa Souza, please pick your question for the second round. Tamsa, please pick your question.
Question number 1, Tamsa Souza. Tutaambia huku Tanzania mtandao bado haujakaa
Tamsa
sawa.
Souza, I don't know what was happening to your network. Huh?
Okay. We are very sorry. We have internet problems, but now we have solved it. We choose question number 1.
Okay. All right.
Yeah.
Thank you.
Thank you.
So question number 1.
Yes.
Which planet is known as the red planet? Your time starts now.
Okay.
Mars. It's Mars. Mars.
Mars.
Yeah.
Mars is very correct. It's
Thank
because the
you.
surface of Mars is covered by iron oxide, so that's why
Yes.
it's referred as
A red
Yes.
the red planet.
planet.
You have 5 points, Thompson. Kumsa, Uganda, please pick your question.
Number 9.
Question number 9.
Question number 9. The term genome was coined to describe what? The term genome was coined to describe what?
The complete set of genes and genetic
Sorry?
material.
A complete set of genes and genetic material.
Can you speak up? They were trying to say something before the time went
Genes
up.
and genetic material.
Complete set of.
Sir, can you hear us?
Genetic material.
Sorry,
Answer.
am I the only one that is not hearing them well?
Complete set of genes and genetic material.
I
Complete
think
set
only one
of
of you
genes.
should say the answer.
Sorry?
May one of you say the answer? Only one of them should say the answer.
One person should say the answer.
Okay.
This is not, I forgot that part of the rule. Please, answer the question before I say what I want to say.
Mr.
What is the
Quizmaster,
answer?
Can you hear
I was
us?
hearing set of
our
genes.
answer was, yes, our answer was a complete set of genes and genetic material.
Please, score recorder, moderator, timekeeper, can you help me understand what they're trying to say? I cannot hear what they are saying.
They're saying that it's a complete set of genes and genetic materials.
Complete set of what?
Genes and genetic materials.
In genetic material. Okay,
Genes
that's
and
correct. That's correct. Please, Kumsa, can you do something now? Maybe you should log out and log in because of your network. I cannot hear you. I can barely hear you. So you are correct. It's a complete set of genes. You have 5 points.
Mr. Quizmaster,
I can still
think
not
our
hear you.
network is
Just
okay.
leave the meeting and join again. I can still not hear you. So you have 5 points, Kumsa. Next is Abumsa. Please pick your question.
25.
Question 25. What is the numerical meaning of MMXXV?
2025. Yes. 2025.
2025.
That is correct. You have 5 points. Abumsa. Lagos State University Medical Students Association. Please pick your question.
Question 24.
Question 24. The skull and crossbone symbol on bottles or packages indicate what?
Poisoning, risk of poisoning.
Poisoning. Poisoning is very correct. You have 5 points. It means poison or something that is toxic. You have 5 points. Nasumsa. Kumsa, Calabar, please pick your question.
Question 21.
Question 21. The coronation of Charles III and his wife Camilla as King and Queen of United Kingdom and Commonwealth realms took place on which day, which month, and which year?
7th October.
Sorry?
7th July.
7th July, what year?
2025.
Charles III and his wife, 7th of July, 2025, this year. Is that a final answer?
Yes.
That's wrong. It cannot be this year. Charles III when did Queen Elizabeth die? Was it this year? So that's wrong. It was May 6, 2023. So you have 0 point, Kumsa. So with this, we've come to the end of.
Excuse me, Quizmaster. Can you
sorry?
hear us? Can you hear us now? Are we audible now?
Sorry?
Are we audible? Are we audible?
Yes,
Can you hear
yes,
us?
better. It's
Or
better now. It's better now. So I forgot to add this. Please, I always advise participants of quizzes to have one spokesperson. Is better because you all are working as a team. So it's better if you want to choose a question, you have somebody that will be choosing your questions for you. People will agree, oh, choose this particular question, the person does that. Then when you come up with an answer, you should have one person that will say it so that 2 or 3 people will not be saying the same answer or different answer. So it makes the team more organized if you choose one person that will be saying the answer, especially the person that is loud enough in the group. So we've come to the end of the general knowledge section. So I will hand over the mic to the score recorder to give us the scores.
Okay, thank
very
you,
much.
Kweko. So the scores for the general knowledge, Ahmadu Bello University got 5 on the first round, 5 on the second round, total of 10. Calabar University got 5 on the first round, 0 on the second round, total of 5. Kabare University got 5 on the first round and 5 on the second round, total of 10. Lagos State University got 0 on the first round, 5 on the second round, total of 5. Olabisi Onabanjo University got 0 on the first round, 5 on the second round, total of 5. Tamsa Souza got 5 on the first round, 5 on the second round, total of 10. That's all.
Okay, score recorder. Thank you very much for that. So I want to say something about the next 2 sections that we're going to have, or this is finals. What we're going to do, our next section is going to be math and logic, then followed by preclinicals and clinicals. So we are going next to math and logic. So I'll be sharing my screen now. My screen, I will unshare my screen so that I will open the questions. Okay, so I'll be sharing my screen now. So our rules still remains the same. You have, for math and logic, you have 15 seconds. Please, 15 seconds to provide your answers. So we'll be starting with Kumsa, Calabar. Please pick your question.
Question 9.
Question 9. During a 5-day festival, the number of visitors tripled each day. If the festival opened on a Thursday with 345 visitors, what was the attendance on that Monday? Your time starts now. Sorry?
4,140.
1,000.
4,140.
1,114. 4,000. Okay, 4,414. You're wrong. The answer is 12,420. You have 0 points, Kumsa. Lasumsa, please pick your question.
Question 2.
Question 2. An adult patient weighs 60 kg and he started on standard high dose treatment for pneumocystic jirovecii pneumonia. Trimethoprim 15 mg per kg per day component given in 4 divided doses provided in trimethoprim SMX. The XS component is 5 times the trimethoprim component. So what is the total daily dose of trimethoprim and SMS?
4.
That's 400.
4 per day. Are you sure?
I'm not sure. Did anybody do anything else?
Yeah, 4 per.
For trimethoprim, 900 milligram. For SMX, 4,005 milligram.
So trimethoprim is 4,000. Sorry?
Trimethoprim, 900 milligram. 900.
Yes.
SMX is 4,005.
4,005. That's very correct. You have 5 points, Lasumsa. Abumsa, please pick your question.
Number 8.
Number 8. A 52-year-old female diagnosed with breast CA 4 years ago and is currently undergoing chemotherapy. 2 days ago, she came to the hospital anemic and had to be transfused. If a unit of whole blood, that's 450 ml, is to be transfused over 4 hours, what is the rate in ml per hour? A ml per hour.
How many?
If you transfuse over to be transfused in 4 hours. So we should just do 450 over 4 hours. 4.
That's not how it is.
Okay.
How many units is she to be transfused? Did they say?
A unit. 1 unit. 450 over 4. Let's just do 450 over 4.
450 over 4.
Oh my God, time. 125 mils per hour.
125 mils per hour.
No, it's 115 mils per hour.
115 mils per hour. Is that your final answer?
Yeah, 4 into 10. 4 into 10. 112 mils per hour. Final answer.
Timekeeper, are you still there? Is that your final answer?
112 mils per hour, yes.
112. 112.5 mils per hour. $112.5 mils per hour. And you said 112. Okay. So in the spirit of fairness, sorry, I won't give the point. Sorry. I wanted to give the point, but subsequently we have some questions like this and it may cause issues. So let's leave this. So you have 0 points, Abumsa. Kumsa, Uganda, please pick your question.
Question 7.
Question 7.
Yes.
The last week of a month, a car dealership sold 23 cars. A new sales promotion came out the first week of the next month, and they sold 38 cars that week. What was the percentage increase in sales from the last week of the previous month compared to the first week of the next month?
Six,
65.2%.
22%.
Sorry?
65.22%.
65.22%. What's happening?
Sir, your
Tabali
answer is
University, 65.22%.
yes. If you round off, it's
It's correct.
65%.
Because you will round it
65%.
off to the nearest whole number. So it's
Yes.
correct. So this is
Yes.
this is what I was trying to avoid the other one, because that 122.5, if you round it off, is 113. So that's what I was trying. Maybe my mind was telling me that something like this will arise. Abumsa, I want to Kumsa, you have your 5 points. Abumsa, you raised your hand. Let me hear you.
Quizmaster, in practice, we know that normally values are usually rounded up or down according to what the medical team determines. So that's why we said 112, because you cannot actually transfuse 112.5 mils. So we think we should be considered.
Abumsa, we'll come back to that question. Let's finish this round. Tamsa Suza, please pick your question. Tamsa, pick your question. I think they are trying to say something, but I cannot hear them. Please type on the chat box. Is there still network issues in Tanzania? I thought it has been resolved.
It has been resolved, but there's still some instability in the network.
Okay. So
I think
question 35.
35.
So Tamsa, you will type your, as soon as you get your answer, please type it on the chat box within the time. So question 35. According to Aristotle, man is dash well-being. Type it, I can't. Social well-being. Okay, that's your final answer. You have 5 points. Tamsa. Alabisi Onabanjo University, please pick your question.
Question 34.
Question 34. Question 34.
Yes.
Question 34.
Yes, 34.
Okay. A certain fishing boat is chartered by 4 people who are to contribute equally to the total charter cost of $480. If each person contributes equally to $200 down payment, how much of the charter cost will each person still hold?
$70.
Each person, $70. That's
Yes.
correct. You have 5 points.
What did you do?
Rabisi Onabanjo University. Okay, back to Abumsa. See, this is a fair quiz. Like I said during the introduction, when we started the quiz the very first time. So I know in clinical practice, you cannot set the drop rates to be 112 per 0.5 drop per hour, though it's set at drop per minute, but you cannot set it at that rate. Theoretically, you are wrong, but clinically, you are right. So, but in the spirit of fairness, because if I ask you what you got, you will tell me that you actually got 112.5, but because clinically it's 112. I know that would be your defense. That would be, but I'm not with you there, so I don't know what you got. But what will happen is that you're going to choose another question. And it's part of going forward. When you are giving your answer, please give it in both the whole number and the decimal. I will be the one to round it off and provide the answer the way I want it. Don't round your own off subsequently.
Excuse me, sir.
I can hear you.
Okay, sir. Sir, about Abumsa's question, I think their question was quite direct and fair. It was 450 divided by 4, sir.
Sorry?
Sir, can you hear me, sir?
Yeah, I can hear you.
Yes, it was 450 divided by 4, which brings it to 112.5. So if you are saying we are in the maths and logic section, so why are you using clinical knowledge why are you assuming for the question? I'm sorry. And also, if you want to you're supposed to round up, which should be 113, not 112, sir. So I think the question was fair enough, sir. Thank you, sir.
Yeah, thank you for your concern. It's just that in as much as this is the math and logic section, we will not ignore the fact that, okay, we know what the question is asking about. I remember a couple of times medical students asking me this question, or when multiple of times, and I remember multiple times me teaching them how to calculate drop rates, and whenever I get the answer, I always round it off to what we normally do in practice. So we don't leave, you cannot tell them, oh, it is 112.5. So if they are treating their patient, how would they account for the 0.5? So in the spirit of fairness, they will pick another question. Pick another question, Abumsa.
Thank you. We pick number 25.
Number 25. A 60-year-old male weighing 70 kg with serum creatinine of 1.4 milligram per dl. Find the creatinine clearance of this man using the formula of age 140 minus age times weight divided. Sorry, leave this question. Leave this question. Pick another question.
Why?
Pick another question.
Okay. Go to show us the menu.
You can't pick this question. They've already said the formula. This question, there was an error here. So pick another question. You can't pick this question.
Okay.
Three.
Number 3.
Question 3. Jim can fill a pool carrying buckets of water in 20 minutes. Sue can do the same job in 40 minutes. Tony can do the same job in 1.5 hours. How quickly can all three fill the pool together?
Okay, C is 90, G is 20, S is 40.
We got 20, 40, and 90.
Yes.
How quickly?
So I'm looking for X. No. Oh my God.
Please don't approximate. Give me your full answer.
20 plus 40 is what? 130, 150, 150 divided by 3.
Timekeeper.
50 minutes. 50 minutes.
50 minutes. 50 minutes. It's 10 minutes. 0.4, Abumsa. The last question, the reason why I asked you to, that question, the formula is not supposed to be there. You have to calculate the cross increments by yourself. So the formula is already there. It's showing you the value you are multiplying, the one you are dividing. So it's not a question. The answer is there already. So that's why I asked you to pick another question, so that it will be fair. So we've come to the first round of math and logic. So we are going to the second round of math and logic. We are starting with Olabisi Onabanjo University. Please pick your question.
Question 33.
Question
33.
33. Sorry, pick another question. Olabisi Onabanjo, please pick another question.
Question 32.
32. There are 12 more apples than oranges in a basket of 36 apples and oranges. What is the probability of picking an orange and apple if they are picked without replacement? The time starts now.
Times 12 over 35. 24 over 36 times 12 over 3. What's that? 24 times 12. 24 over 36.
Please don't approximate.
Is 2 over 3 times 12. That's 2 times 4 is 8. 8 over 35 is what?
The time is up.
8 over 35.
Time is up, sorry.
8 over 35.
Time is up. The timekeeper was saying time is up. Said it like 2 times. So time was up. Thank you. You have 0 points. Olabisi Onabanjo University. Tamsa Suza, please pick your question.
27.
Question 7.
27.
27.
27.
Yes.
27. Tanya is older than Eric. Cliff is older than Tanya. Eric is younger than Cliff. If the first 2 statements are true, the third statement is dash. Is what?
It's also true. It
is
is
also true.
Yes.
The third statement is also true. That's correct. You have 5 points, Tamsa.
Thank you.
Kabale University, Kumsa, please pick your question. Kumsa from Uganda, please pick your question.
Question 29.
Question 29.
Yes.
Function of educational structure is A, replacement of population, B, socialization of new populations, C, maintenance of a sense of purpose, and D, system maintenance.
Is it B? B for socialization of new population.
Socialization of new population.
It's worse than before now.
Yes.
It was not that bad for Toshibiki. Yes. It was just
Socialization of new population is correct. Kumsa, you have 5 points. Sorry, if you are not answering a question, please mute yourself. Please. Abumsa, please pick your question.
Question number 24.
Question number 24. Question number 24.
Yes.
I'm an odd number, but when one letter is taken from me, I become even. Who am I? Who am I? Sorry?
Who was your mother?
11.
Hello, post me.
You are what?
11.
You are 11. So the answer is 7.
We've answered this question.
The answer is 7. You have 0 points, Abumsa. Lagos State University, please pick your question.
Question 28.
Philosophers are those who are lovers of the vision of truth, which was said by who? Your time starts
Socrates.
now. Socrates.
Socrates.
Your final answer.
This is now.
Yes.
Yes.
Socrates. That's correct. You have 5 points, Lasumsa. Kumsa, Calabar, please pick your question.
Question 23.
Sorry?
Question 23. Question 23.
Question 23. During a math class, Elton feels cold. Where should he go to sit? Your time is going.
Middle of the class.
Sorry?
Middle of the class.
Middle of the class.
Yeah. Inside the class. Okay.
Time is
At
up.
the
Time is
corner.
up.
At the corner is
Time is up.
at the corner is the answer. You have 0 points, Kumsa. Okay, we've come to the end of math and logic. Please, the score recorder, can we have your scores?
Okay, thank you. So the scores for the math and logic round. Ahmadu Bello University got 0 on the first round, 0 on the second round, total of 0. Calabar University got 0 on the first round, 0 on the second round, total of 0. Kabare University got 5 on the first round, 5 on the second round, total of 10. Lagos State University got 5 on the first round, 5 on the second round, total of 10. Olabisi Onabanjo University got 5 on the first round, 0 on the second round, total of 5. Tamsa Suza got 5 on the first round, 5 on the second round, total of 10. That's all.
Okay, so thank you very much, score recorder. So we're going to take 5 minutes break before we start the preclinicals, then the clinicals. So 5 minutes, please, let's all be back. Thank you. Okay, please let's start joining and repositioning ourselves for the preclinical section. Okay, I believe you all can hear me. Please, if you cannot hear me, just let me know. Either you exit the meeting and join immediately, or you raise your hand that you cannot hear anything. So we are starting now for the preclinical round, but there's going to be a change from what is previously known in the preclinical and the clinical rounds. That's why I left those two for the as the last two finals, as the last two sections. So we will be using the LECTURIO platform directly. Before now, we extract the questions from LECTURIO platform and use on Zoom link. But for these finals and subsequent finals next year, next 2 years, next 3 years, ongoing questions, the LECTURIO platform will be used on the finals. So for those of you that are not in final year yet, those in penultimate class, so and you want to participate in next year quiz, so you just have to prepare your mind that it's the platform that will be used for the final. So you can also tell others that are not here in the meeting. So what I'm going to do now is I will share my screen. I will log into the platform. I will generate the questions and we'll start. The platform is such a way that you can generate as many, if you remember the orientation I gave and I showed the platform, I said you can generate as much questions as possible. We have more than 20,000 clinical questions, preclinical questions, so you can generate any number of questions that you want. So that's what I'm going to do now. But before generating the questions, I'm going to share my screen. So it's such that the first question is what is going to show. So there won't be any number one question, please. So you will start choosing from number two. Because immediately I finish generating the questions, the number one question appears. And I will use that to tell people how to answer the questions. Then we start. So that when we get to clinical section, it's the same thing as the preclinical section. So I'm going to share my screen now. Are you seeing my screen?
No, we can't see
Can
it.
you see my screen?
No, we can't see it.
Sorry?
We cannot see it.
Okay, can you see it now?
Just a moment, it's loading.
Can you see it now?
Yeah, we see Firefox.
All right.
Okay. You go straight.
Okay, so I'll be logging into the LECTURIO platform now. Okay, so can you see my screen? Is it clear from your end? Can you
Yes,
see
it
my
is.
screen?
Yes, we can.
You are LECTURIO Test Academy. Yes, we can.
All right, so this, like I explained during the orientation, so the question we will go from preclinicals to the clinical section. So we're going to use the basic ones that we know for our for our medical school, which is MBBS or those that have MBCHB. So for the clinicals, you can see different sections that will have USMLE, SPLAB, but we are going to stick to MBBS/MBBCH, the preclinical section. So then, please, if it's not clear from your end, let me know. So we are going to choose easy. Let me choose easy. We have medium, we have hard. So I'll choose easy. So that you will not see questions and you will shout. So I'll choose easy. Then the subjects that we're going to be looking at in the preclinical sections is going to be limited to anatomy, biochemistry, embryology, histology, physiology. So these are the ones we will focus on. But you can see under the preclinical section, there are other sections. So they will focus on these basic preclinical sections. Then for the systems we'll be looking at, we look at almost all the systems. We are not leaving anyone behind. So we are going to here, you can select any number of questions that you want. If you want 10,000 questions, just put the values and you get what you want. So, but for this quiz, we'll be generating just 20 questions. Just 20 questions. Okay. I hope you can still see my screen. Can you see my screen? Can you all see my screen?
Yes, your screen is visible.
Sorry?
Yes. We can see your screen.
All right, thank you very much. So if you look at this side, you see all the questions from number 1 to number 20. The question you are seeing at the moment is question number 1. And remember I said question number 1, nobody will choose that one. I will use it to explain. So for this section and the next section, because for this section and the next section, it's going to be 15 seconds per question. Please, timekeeper, take notes. 15 seconds per question, unlike our usual 10 seconds per question in preclinicals and clinicals. So it's going to be 15 seconds per question. So when you choose an answer, let's assume that this is number 1 and you are choosing celiac trunk. Then is for me to click submit answer and show explanation. There are different reasons, like they will show you the different, this is wrong. They will show you different, this is incorrect. So this is the explanation. There are related videos. These are the explanations of why the other options are not correct and why inferior mesenteric artery is correct. But we are not going to the explanation. So what we are looking at is whether you got it correct or whether it is incorrect. I hope it's clear now. Is it clear?
Yes,
Does anybody
yes,
have any question before we start?
Will you be reading out the questions?
Yes, I will. Remember, your time starts after I finish reading the question. That's when your time starts, please. After I finish reading the question, that's when your time starts, because there are some questions that are very long. So after I finish reading the question, if you remember, once I finish reading the question, I will tell you your time starts now. So remember, it's still the same thing. So the first question on this list now is going to be number 2. So we are starting with Kumsa Calabar. Pick your question from number 2 to number 20. I hope it's clear, like it's very clear. Nobody has any issues with it, like the explanation I gave. So pick your question from number 2 to number 20. Calabar. Number 6. Question 6. This question 6. A 50-year-old man visits his physician after 20 years of not seeking any medical care. He wants to be checked out because his colleague recently suffered a heart attack, which made him wonder about his own health status. He has no active complaint and says he feels healthy. He states that he does not exercise regularly and lives a sedentary lifestyle. He is employed in an administrative position at a local college and is seated at a desk most of the day. His father had a heart attack at age of 54, and his mother is still alive with no health concern. He does not smoke, only drinks socially, and does not use drugs. His blood pressure is 130/88 millimeters of mercury. Pulse is 84 beats per minute, and respiratory rate is 14 cycles per minute. His BMI is 32 kilograms per meter square. Other than obesity, his physical exam is unremarkable, and ECG shows no abnormality. The laboratory studies were as below. Serum glucose, that's the fasting, was 105 milligrams per DL. The electrolytes are as follows: sodium 142, potassium 3.9, chloride 101, serum creatinine 0.8, blood urea nitrogen 10, cholesterol 270, HDL 25, LDL 206, triglyceride 170. The urinalysis, glucose is negative, ketone negative, glucoside negative, nitrite negative, red blood cell negative, CAT cell negative. HDL, okay, HDL is high density lipoprotein, LDL is low density lipoprotein. So which of the following is an indication for immediate pharmacologic treatment in this man? The time starts now.
Come down. Please come up. Please, let's see the option.
Option.
Time is up.
D. Option D.
Option D.
LDL.
Option D. Sorry?
Yes, D.
LDL. Timekeeper, they said before time, right?
Yes.
Yes.
Okay.
Yes,
Thank
they
you.
said before.
So option D. Let's see the answer. Option D is very correct. You have 5 points, Kumsa. So, Lasumsa, your question. Please remember your time starts after I finish reading the question, no matter how long it is. That's why I told you earlier. Your time starts after I finish reading the question. Lasumsa, your question.
Question 8.
Question 8. Question 8. A medical student is studying human physiology. She learns that there is a membrane potential across cell membranes that in excitable cells. The differential distribution of anions and cations, both inside and outside the cells, significantly contributes to the genesis of the membrane potential. Which of the following distributions of anions and cations best explains the above phenomenon? A, high concentration of sodium outside the cell and high concentration of potassium inside the cell. B, high concentration of potassium outside the cell and low concentration of potassium inside the cell. C, high concentration of calcium outside the cell and low concentration of chloride inside the cell. D, low concentration of chloride outside the cell and high concentration of chloride inside the cell. E, low concentration of potassium outside the cell and high concentration of calcium inside the cell. Your time starts now.
A for apple.
A for apple, high concentration of sodium outside the cell and high concentration of potassium inside the cell. So let's see the answer. It's very correct. You have 5 points, Lasumsa. So, Abumsa, please pick your question.
Question 3.
Question 3. Question 3. A 69-year-old man presents for a follow-up visit for his chronic heart failure. His provider is considering treating him with a new drug, candoxatril, that has the ability to inhibit an endopeptidase that breaks down a vasodilatory mediator, one that is released from the heart when in congestive failure. This vasodilatory mediator is known to promote the excretion of sodium from the body and improve the ejection fraction. One of its side effects is its ability to increase angiotensin II levels, which causes harm to patients with heart failure. For this reason, candoxatril has to be used in conjunction with angiotensin receptor blockers. Which of the following is most likely to increase as a result of this drug regimen? A, thromboxane, B, nitric oxide, C, leukotrienes, D, acetylcholine, and E, natriuretic peptides. Your time starts now.
Natriuretic
Those are
peptide.
the two things in my head. Time.
Natriuretic peptide.
Natriuretic peptide, option E. So let's see the answer. Option E. Natriuretic peptide is very correct. You have 5 points, Abumsa. So, Kumsa, Uganda, please pick your question.
Question number 2.
Question number 2.
Yes.
Question number 2. Okay. A 37-year-old man presents with dull, continuous epigastric pain that radiates to his back. His history is significant for 2 episodes of acute pancreatitis that were managed conservatively. He reports no history of similar episodes in his relatives and denies a family history of any cardiovascular or gastrointestinal disorders. His vital signs include blood pressure of 105/70 millimeters of mercury, heart rate of 101 beats per minute, respiratory rate of 17 cycles per minute, and temperature of 37.4 degrees Celsius. The physical examination reveals epigastric tenderness, slight muscle guarding, and abdominal distension. Laboratory studies shows the following findings. Erythrocyte of, as you can see on the screen, HB, that's hemoglobin of 14.7, hematocrit of 43%, leukocyte 12,700, segmented neutrophils of 65%, band cells of 14%, eosinophils of 1%, basophil of 0%, lymphocyte of 27%, monocyte of 3%. Biochemical studies shows serum amylase of 170, ALT of 21, AST of 19, total serum cholesterol of 139, serum triglyceride of 127. The magnetic resonance cholangiopancreatography finding are shown in the figure above. What embryonic disruption could cause such anatomic findings? So see the MRI. So the options: A, duplication of embryonic pancreatic ducts; B, ectopy of the developing bile duct; C, failure of the dorsal and ventral pancreatic ducts to fuse; D, duplication of the pancreatic board of the midgut; and E, improper rotation of the anterior pancreatic board. Your time starts now.
C for cat.
C for cat.
Failure of.
C for cat.
C for cat. Is that your final answer? I'm taking my time to show you the questions. Is that a final answer? C for cat.
Yes.
C for cat. Failure of the dorsal and the ventral pancreatic duct to fuse. So let's see the answer. C for cat is very correct. You have 5 points, Umsa. Tamsa Suza, please don't be in a hurry to pick, provided you are answering within the time frame. I will show you the question. If there are images, I will still show you, provided you pick your answer within the time frame, within the 15 seconds. So don't just rush to answer and maybe you just miss out something. You have 15 seconds. So you can use like 10 seconds to conclude your answer. In the last 5 seconds, you will say your answer so that you don't rush. All right, we are moving to Tamsa St. Francis. Please pick your question.
It is Tamsa Souza.
Tamsa Souza, yes, that's St. Francis. Am I wrong?
Oh, we had Tamsa St. Francis. Okay. Question number 7.
Number 7. Number 7. A 42-year-old woman presents to the emergency department with a loss of sensation in her left upper extremity. A rapid evaluation is performed to rule out a stroke. Neurological examination reveals loss of fine touch sensation in the C6 dermatoma pattern, but is otherwise unremarkable. Further evaluation reveals that the patient was recently sick with an upper respiratory infection. After an extensive but inconclusive neurological workup, a biopsy is performed, which shows destruction of cell bodies of sensory nerves, which of the following structures is most likely damaged? A, the Meissner's corpus. B, the dorsal root ganglion. C, the ventral root ganglion. D, the dorsal column. And E, the lateral corticospinal tract. Your time starts now.
B.
B for ball.
B for
B for
ball.
ball.
Is that your
Yes.
final answer?
Yes.
B for ball. Dorsal root ganglion. Let's see. That's very correct. You have 5 points. Thumbs up. So, Olabisi Onabanjo University, please pick your question.
Question 5.
Question.
Let's change page.
Question
Question 9.
what?
Question 9.
Question 9. Okay. Question 9. A 2-day-old boy fails to pass meconium during the first 48 hours of life. He was born at term to a healthy 19-year-old woman after an uncomplicated pregnancy. At birth, his weight was 3.9 kg. Currently, he weighs 3.8 kg. His blood pressure is 70/50 millimeters of mercury. Pulse is 130 beats per minute. Respiratory rate of 33 cycles per minute and temperature of 37.0 degrees Celsius. On physical examination, he is fussy and appears mildly dehydrated. The bowel sounds are active on auscultation. His abdomen is mildly distended and no masses can be identified on palpation. The patient's anus is patent. An upper gastrointestinal study with oral contrast demonstrates normal anatomy. A lower gastrointestinal series with barium enema reveals a large amount of retained barium contrast within the dilated sigmoid colon and a normal appearing rectum. The barium solution retention persists beyond 24 hours after administration. Which of the following best describes the cause of the patient's symptoms? A, failure of the neural crest cells to migrate caudally to the intestinal wall during embryogenesis. B, disruption of the apoptosis of the intestinal cells. C, hypertrophy of the muscular layer of the lower sigmoid colon. D, propelling of a polyp distally by peristalsis. And E, decreased blood supply to the developing intestine in the embryonic.
A for apple. A for
A
apple.
for apple. Your time starts now.
A for apple.
Is that your final answer?
Yes.
A for apple. So you are correct. You have 5 points. Olabisi Onabanjo University. So we've come to the end of the first round of the preclinicals. So we are going to the second round now, and we'll be starting with Olabisi Onabanjo University. Olabisi Onabanjo University, please pick your question.
Question 10.
Question 10. A 22-year-old woman presents to the gynecologist for evaluation of amenorrhea and dyspareunia. The patient states that she recently got married and has been worried about getting pregnant. The patient states that she has never had a period and that sex has always been painful. An examination, patient is standard stage 5 with no obvious developmental abnormalities. The vaginal exam is limited with no identified vaginal canal. What is the most likely cause of the patient's symptoms? A, hyperprolactinemia. B, exposure to DES, that's diethyl esters in Exposure to death in utero, Turner syndrome, PCOS, Mullerian agenesis.
B for boy. B for boy.
Okay. B for boy. Is that your final answer?
Yes.
That's wrong. The answer is Mullerian agenesis. So you have 0 points. Omsa. Tamsa, St. Francis, please speak your question.
Is it Tamsa Suza? Excuse me. Is it Tamsa Suza or Tamsa St. Francis? Tamsa St. Francis.
It is Tamsa
Suza. Sorry, Tamsa Suza, is it different from Tamsa St. Francis?
It's different.
No, it's not. And Tamsa St. Francis are not here, not in the final.
Okay.
Tamsa Suza.
Number 11.
Question number 11.
Number 11.
Okay. A 56-year-old woman present to the emergency department for nausea and severe unrelenting right upper quadrant abdominal pain. She underwent cholecystectomy for gallstone a year ago and has since experienced frequent recurrence of abdominal pain, most often after a meal. Her past medical history is otherwise unremarkable, and she only takes medications for her pain when it is intolerable. Her physical examination is normal except for pain upon deep palpation of the right upper abdomen. Her laboratory values are unremarkable, with the exception of mild elevation of alkaline phosphatase, amylase, and lipase levels. Abdominal ultrasound shows a slightly dilated common bile duct measuring 8 millimeters in diameter and a normal pancreatic duct. She is referred to a gastroenterology clinic for endoscopic retrograde cholangiopancreatography to stent her common bile duct. During the procedure, the sphincter at the entrance of the duct is constricted. Which statement correctly describes how the sphincter size is regulated? A hormone released by the eye cells of the duodenum in the presence of fatty acid is the most potent factor causing sphincter relaxation. B, sphincter remains contracted between meals. C, the relaxation of the sphincter is enhanced by the stimulation of opioid receptors. D, a hormone released by the M cells of the duodenum is the most effective cause of relaxation. And E, regulation of the sphincter does not involve neural inputs. Your time starts now.
B.
B for ball. B for ball.
B for ball. Is that your final answer?
Yes.
B for ball. B for ball is wrong. You have 0 points. Tamsa Suza. The answer is A. So,
okay.
The answer is A. The next school is Kumsa, Kabali, Uganda.
Question 13.
Number 13.
Question number 13.
Question number 13.
Yes.
Yes.
So question number 13. A 29-year-old woman who is breastfeeding her 3-month-old infant reports difficulty with milk flow when she is anxious about returning to work. Her physician explains the physiological basis for this phenomenon. Which of the following best describes how the sympathetic nervous system affects lactation? A. Stimulation of beta-adrenergic receptors in the myepithelial cells enhances milk ejection. B. Alpha-adrenergic stimulation increases blood flow to the breast to promote milk production. C. Sympathetic activation inhibits oxytocin release from the posterior pituitary. D. Norepinephrine directly competes with prolactin at mammary gland receptors. And E. Sympathetic activation increases areolar smooth muscle contractility in the breast.
C for cat.
C for cat.
C for
Is that your
cat.
final answer?
Yes. Yes, sir.
C for cat. C for cat is correct. You have 5 points, Kumsa. So next we are going to Abumsa. Please pick your question.
Question 5.
Question what?
5.
Question 5. Question 5. A 34-year-old female presents to the emergency department with sudden onset headache, severe headache, described as the worst headache of my life. She has photophobia and neck stiffness. CT scan shows subarachnoid hemorrhage along the left sylvian feature. Cerebral angiography is performed and reveals an arteriovenous malformation with an aneurysm on the vessel that passes along the lateral sulcus and supplies the primary motor and sensory cortex. Which of the following cerebral arteries is most likely involved in this patient's pathology? A. Anterior cerebral artery. B. Middle cerebral artery. C. Posterior cerebral artery. D. Anterior communicating artery. And E. Posterior communicating artery.
Yeah, that's right. B. Middle cerebral artery.
B. Middle cerebral artery. Is that your final answer?
Yes.
B. Middle cerebral artery is correct. You have 5 points. Lagos State University, please pick your question. Nasumsa.
Question 16.
Question 16. A 69-year-old man presents for surgery due to chronic pain associated with diverticulosis involving the sigmoid colon. The patient is a Jehovah's Witness and refuses blood transfusion, even in an emergency. Which artery should be clamped briefly to prevent bleeding during the partial sigmoidectomy? A. The superior mesenteric artery. B. Inferior mesenteric artery. C. Celiac trunk. D. Inferior rectal artery. And E. Splenic artery.
B for ball. Inferior mesenteric artery.
Inferior mesenteric artery. Is that your final answer?
Yes.
Inferior mesenteric artery is correct. You have 5 points. Lasumsa. Umsa, Calabar, please pick your question. Calabar, please pick your question. Kumsa.
Question 20.
Question 20. A newborn is 2 hours old. She was born at 33 weeks gestation to a primary gravid 29-year-old mother who has no significant past medical history. The newborn shows severe tachypnea, grunting, and nasal flaring on physical examination. A chest radiograph shows hypoinflation, diffuse bilateral granular opacities, and air bronchogram. Intubation is currently being planned. Based on the most likely diagnosis, which of the following cells are responsible for the present situation? A, the Clara cells. B, ciliated epithelium. C, type 1 pneumocytes. D, alveolar macrophages. And E, type 2 pneumocytes.
E for egg.
E for egg, type 2 pneumocytes.
Yes.
Is that your final answer?
Yes.
That's correct. You have 5 points, Calabar. So we've come to the end of the preclinical round. So the score recorder, please, can we have your scores? Thank you. Sorry? I could barely hear you. Huh? Score recorder, can anyone hear score recorder? Score recorder. Score recorder, please, can you
Hello?
exit? Yeah.
I think the network is not good, but he was asking the score for Abumsa, Ahmad Bello.
Ahmad Bello got their point. They have 5 points.
Okay.
Score recorder, please, can you exit the meeting and join again so that your network can stabilize?
Amadu Bello, we got both our questions in this round.
Nobody is arguing that.
Hello, can you hear me now?
Yes, we can hear you.
Okay, sorry for the network issues. So, the scores for the clinical rounds, Hamadu Bello University got 5 on the first round, 5 on the second round, total of 10. Calabar University got 5 on the first round, 5 on the second round, total of 10. Kabale University got 5 on the first round, 5 on the second round, total of 10. Lagos State University got 5 on the first round, 5 on the second round, total of 10. Olabisi Onabanjo University got 5 on the first round, 0 on the second round, total of 5. Tamsa Suza got 5 on the first round, 0 on the second round, total of 5. That's all.
All right, thank you very much. So we'll be moving to the clinical section. The same way we did in the preclinical, that's what we are also going to do. Okay, so the DES is diethyl stilbestrol. So for some of you that also find it difficult to pronounce like me. Okay, we still have some questions unanswered. In case of tiebreaker, we can still come back to this. So we'll be exiting this page. So now we are going to clinicals. So we will not use PLAB or USMLE standard. We use our MBBS, MBCHB standard. So for the clinicals, we will not use hard. We're not using medium. We're going to use easy, so that you will not see the question and you shout out of surprise. So the subjects we are taking into consideration, we include internal medicine, to include pediatrics, to include obstetrics and gynecology, to include surgery, psychiatry, biostatistics, family medicine, and social sciences / ethics. So it's part of clinicals. Then the systems that we are also going to include, we are going to include all the systems: acute care, chronic diseases, endocrine system, general principles, hematology and oncology, musculoskeletal system, obstetrics, renal system, respiratory system, cardiovascular system, dermatology, gastrointestinal system, gynecology, infectious disease, nervous system, preventive medicine, reproductive system, rheumatology. So we reduce this to, remember I said you can generate as many questions you want, but here we'll just reduce it to 20 questions. So any number of questions you want, you can generate from here. So as usual, our number one question is out because it's going to show automatically. So we are starting from number 2 question, just like we did in preclinicals. So we'll be starting with Kumsa. Please pick your question.
Question 9.
Question 9. A 53-year-old woman presents to a physician because of 5-year history of cough. The cough is worse in the morning and she has a lot of phlegm. There is no history of weight loss or constitutional symptoms of fever and malaria. She works in a cotton mill and has never smoked, but has been hospitalized for respiratory issues 6 times in the last 3 years. She was never completely free from her respiratory problems during the period between the exacerbations, and she has had a productive cough for the most part over the last 3 years. Her family history is significant for asthma in her mother and grandmother. Vital signs are temperature of 37.1, heart rate of 92 beats per minute, respiratory rate of 22 cycles per minute, blood pressure of 130/86 millimeters of mercury. Physical examination is significant for obesity, mild cyanosis, and bilateral coarse bronchi. Pulmonary function test shows FEV1 58% for pre-bronchodilator and 63% for post-bronchodilator. FVC of 90% for pre-bronchodilator and 92% for post-bronchodilator. FEV1 divided by FVC of 0.62 for pre-bronchodilator and 0.63 for post-bronchodilator. TLC of 98% for pre-bronchodilator and 98% for post-bronchodilator. The results are valid and repeatable as per standard criteria. What is the most likely diagnosis? A. Persistent asthma. B. COPD with predominant chronic bronchitis. C. COPD with predominant emphysema. D. Idiopathic pulmonary fibrosis. And E. Extrinsic allergic alveolitis. Your time starts now.
Please go off.
Was in the morning, she's not. So he should. Go to B. Yes.
B for boy. B for boy.
Your final answer?
Yes.
Is that your final answer?
Yes.
D for
Boy.
B for boy.
Yes.
That's very correct. You have 5 points, Kumsa. The next is Lasumsa. Please pick your question.
Question 18.
Question 18. A 68-year-old man present to the emergency department with shortness of breath for the past 2 hours. He mentioned that he has had a cough, cold, and fever for the last 3 days and has taken an over-the-counter decongestant. He has had hypertension and known coronary artery disease for the last 7 years. His regular medications include aspirin and Ramipre. On physical examination, his temperature is 36.9 degrees Celsius, heart rate of 120 beats per minute, blood pressure of 118/80 millimeters of mercury, and respiratory rate of 24 cycles per minute. Pulse oximetry shows an oxygen saturation of 99%. On auscultation, pulmonary crackles are heard over the lung bases bilaterally. Auscultation of the precordium reveals a third heart sound. Mild, tender hepatomegaly is present. Pitting edema is noted bilaterally halfway up the calves, and the feet are warm to touch. A chest radiograph does not show any focal areas of airspace consolidation. What medication is indicated in this patient's initial management? A. Dobutamine. B. Digoxin. C. Furosemide. D. Nitroprusside. E. Nitroglycerin. And F. Milligram. The time starts now.
C for cat.
C for cat. Is that your final answer?
Yes.
sir.
Furosemide. That's very correct. You have 5 points, Lasumsa. Please don't rush. Don't rush to answer. That's why I'm reading the questions very slowly for everybody, just to make sure that you understand every sentence, every word in the question. Please don't rush to answer. That's why I increased it to 15 seconds, and it starts after I finish reading the question. So next is Abumsa. Abumsa, pick your question.
Number 3.
Question 3. An 18-year-old woman presents for a wellness exam. She is a college student and has no complaint. She had the HPV vaccination series at age 12. Her first sexual encounter was at age 15, and she has had 2 sexual partners. She takes oral contraceptives and uses barrier contraception. Her family history is significant for cervical cancer in her mother. Which of the following statements regarding cervical cancer screening in this patient is correct? A. This patient requires annual pap testing because of her family history of cervical cancer. B. This patient does not require pap testing because she has been vaccinated against HPV. C. The patient should undergo pap testing every 3 years, starting at age 21. D, HPV testing is preferable to pap testing in sexually active women under the age of 21 years. And E, it is recommended to start cervical cytology testing, that's pap smear, at the current visit, and to repeat the test every 3 years. The time starts now.
Seconds. It's 15 seconds.
Yeah, 15 seconds will be above now.
B. B.
B for boy.
B for boy. Is that your final answer? Is that your final answer?
Yes.
B for boy. B for boy is wrong. The answer is C. The patient should undergo pap testing every 3 years, starting at age 21. You have 0 points, Abumsa. So the next is Kumsa, Kabale University. Please pick your question.
Question 11.
Question number 11.
Question number 11.
Yes.
A 71-year-old man present to the emergency department after having a generalized tonic-clonic seizure. His son states the patient does not have a history of seizures but complains of nausea and headache the past 2 days. He has had increasing lethargy and generalized weakness over the past 2 weeks. His temperature is 37 degrees Celsius, respiratory rate 14 cycles per minute, pulse rate 67 beats per minute, and blood pressure 132/88 millimeters of mercury. On examination, he is disoriented, but his mucous membrane is the mucous membranes are moist and the skin turgor is good. The pupillary exam is normal. His heart has a regular reading without murmur. His lungs are clear to auscultation bilaterally, and abdomen is soft, and his extremities have no edema. Motor strength is 4/5 and symmetrical bilaterally. And there is hyporeflexia in all 4 extremities. Laboratory results shows a serum sodium level of 120, glucose of 94 milligram per dl, and serum osmolarity of 248 milliosmol per kg. His urine sodium and osmolarity are high. What is the most likely cause of his hyponatremia? A, syndrome of inappropriate antidiuretic hormone. B, water intoxication. C, lithium use. D, diabetic ketoacidosis. And E, hereditary diabetic insipidus. The time starts now.
F for apple. A for apple.
A for apple, syndrome of inappropriate antidiuretic hormone secretion. Is that your final answer?
Yes, sir.
Syndrome of inappropriate ADH secretion is very correct. You have 5 points, Komsa.
Excellent. One.
Tamsa Souza. Tamsa Souza, please pick your question.
Number 2.
Number 2.
Yes.
Number 2. A 4-week-old girl develops poor feeding and respiratory distress while in the NICU. She was born at 29 weeks gestation via cesarean section due to reduced movement and a non-reassuring fetal heart tracing. APGAR scores were 6 and 8 at 1 and 5 minutes respectively. Vital signs today include blood pressure of 54 over 22 millimeters of mercury, heart rate of 180 beats per minute, and respiratory rate of 66 cycles per minute. The patient appears uncomfortable with a rapid respiratory rate and mild cyanosis of the fingers and toes. She also has nasal flaring and grunting. Her legs appear edematous. A chest X-ray shows evidence of congestive heart failure. An echocardiogram shows a PDA with enlargement of the left atrium and ventricle. What medication would be appropriate to treat this infant condition? A. Indomethacin. B. Methadone. C. Caffeine. D. Alprostadil. And E. Dexamethasone. Your time starts now. The time is going.
A.
A. Indomethacin. Is that your final answer?
D. Sorry, D. Sorry,
D.
I prostadil. D. Yes.
Is that your
D for
final
dog.
answer?
Yes.
Okay. Please, the monitoring team, I hope you are looking at them. So D.
Yes.
D is wrong. A was actually correct.
A.
You have 0 points. Answer. I don't know why you changed your answer, but it is what it is. So Olabisi Onabanjo University, please pick your question.
After this, question 6.
Question 6. A 7-year-old boy is rushed to the urgent care department from a friend's birthday party due to difficulty with breathing. He is immediately placed on supplemental oxygen therapy. His past medical history is significant for peanut allergy and asthma, and the boy's father states peanut butter treats were served peanut butter treats were served at the event, but he didn't see his son eat one. The boy has facial flushing, difficulty in breathing, and itching of his face and neck. He was born at 40 weeks gestation via spontaneous vaginal delivery. He has met all age-related developmental milestones and is fully vaccinated. He carries an emergency inhaler. Family history is not contributory. His blood pressure is 110/85 millimeters of mercury. Heart rate is 130 beats per minute. Respiratory rate is 35 cycles per minute. And temperature is 37.2 degrees Celsius. Physical examination reveals severe facial edema and audible stridor. Which of the following types of hypersensitivity reaction is most likely in this patient? A. Type 1 anaphylactic hypersensitivity reaction. Type 2, that's cytotoxic hypersensitivity reaction. Type 3, that's immune complex mediated hypersensitivity reaction. Type 4, that's cell-mediated or delay hypersensitivity reaction. Then mixed anaphylactic and immune complex mediated hypersensitivity reaction. Your time starts now.
A for apple.
A for apple. Type 1, that's anaphylactic hypersensitivity reaction. Is that your final answer?
Yes.
Type 1 hypersensitivity reaction is correct. We have 5 points. So we are going to the second round of the clinicals. So Olabisi Onabanjo University, you pick your question.
Question 7.
Question 7. 13-month-old boy with sickle cell anemia is brought to the emergency department because of continuous crying and severe left hand swelling. His condition started 2 hours earlier without any preceding trauma. The child was given diclofenac syrup at home with no relief. His temperature is 37 degrees Celsius, blood pressure is 110/70 millimeters of mercury, and pulse of 140 beats per minute. Physical exam reveals swelling and tenderness to palpation of the left hand. The hemoglobin level is 10.4 grams per dl. Which of the following is the best initial step in management of this patient's condition? A. Intravenous morphine. B. Intravenous meperidine. C. Joint aspiration. D. Sensitive spirometry. And E. Magnetic resonance imaging of the affected joints. Your time starts now.
B for boy.
B for boy. Is that your final answer?
Yes.
Intravenous meperidine. That's wrong. Intravenous morphine is the right answer. You have 0 points. Olabisi Onabanjo University. Kamsa Souza, please pick your question.
Number 7.
Question 7. Question 7 has been picked. That's the question. Look at, if you see the numbers by this side, the ones with dots in front of them are questions that are not being picked.
Question 2.
Question 2 has been picked. The questions that has dots in front of them have not been picked.
Okay. Gotcha. Question 12.
Question 12. A 14-year-old obese boy presents with severe right hip and knee pain. The patient says that he has been limping with mild pain for the past 3 weeks, but the pain acutely worsened today. He described the pain as severe, non-radiating, sharp, and aching in character, and localized to the right hip and knee joints. Patient denies recent illness, travel, trauma, or similar symptoms in the past. He has no significant past medical history and takes no medication. The patient is not sexually active and denies alcohol, smoking, or use of drugs. His temperature is 37.0 degrees Celsius, blood pressure is 110/70 millimeters of mercury, and pulse is 72 beats per minute. Respiration is 15 cycles per minute, and oxygen saturation is 99% on room air. His body mass index is 32 kilograms per meter square. On physical examination, the patient is alert and cooperative. The right leg is externally rotated, and there is limited range of motion in the right hip. Strength is 2/5 at the right hip and 5/5 elsewhere. There is no tenderness to palpation, no joint erythema or edema or effusion, and sensation is intact. Deep tendon reflexes are 2 pluses bilaterally. Laboratory tests are unremarkable. Plain radiograph of the right hip joint are significant for displacing the right femoral head infraposteriorly of the femoral neck. Which of the following is the most appropriate course of treatment for this patient? A. The patient should be reassessed in 3 months. B. Immobilize the right knee with conservative treatment. C. intra-articular corticosteroid injection of the right hip joint? D. Pelvic harness, and E. Surgical pinning of the right hip. Your time starts now.
E.
E for egg.
Is that your
E for
final
egg.
answer? Is that your final answer?
Yes.
E for egg. Your time is still on. Is that your final answer?
Yes.
E for egg is correct. You have 5 point answer.
Thank you.
That's correct.
Komsa, please pick your question. Komsa. Please, the essence of reading the question slowly is to make sure that you grab everything from the question. So that's why I'm slow with the question, so that I will make sure that you understand every single word, because every single word in the question points towards the answer. Komsa, Kabale University, pick your question.
Question 17.
Question 17. 17. A 19-year-old woman presents to a gynecologist because of amenorrhea and occasional right-sided lower abdominal pain that radiates to the rectum. She had menarche at age 11 and began having regular 28-day cycles. Her menstrual cycles became irregular about 2 years ago, and she has not had a period in the last 6 months. She has not been sexually active in the previous 6 months and does not take any medications. Her height is 166 centimeters, weight is 94 kilograms, and body mass index is 35.5 kilograms per meter square. Vital signs are within normal ranges. A physical exam shows a normal hair growth pattern with no acne. There is blackish discoloration of the skin in the axilla and on the posterior neck. The abdomen is slightly tender in the right lower quadrant, but has no masses. But there are no masses. A bimanual exam reveals a non-tender mobile right-sided adnexia mass. A urine pregnancy test is negative. Which of the following statements is most accurate regarding this patient? A. No imaging is indicated because the diagnosis can be made based on the clinical findings. B. Transvaginal ultrasound provides better visualization of the suspected pathology, but transabdominal ultrasound can still be used. C. Increased anterior abdominal wall adiposity does not pose any problem with a full urinary bladder. So, transabdominal ultrasound scan will provide the same sensitivity as transvaginal ultrasound scan. D. Transabdominal ultrasound scan can detect small pelvic masses better than transvaginal ultrasound. E. A pelvic MRI is needed. Your time starts now.
B for boy.
B for boy.
B for boy. Is that your
Yes.
final answer?
Yes.
Yes.
B for boy is correct. You have 5 points. Kumsa. ABO, Abumsa, please pick your question.
Number 8.
Question 8.
Question 8. A 2-day-old boy born at 38-week gestation presents with jaundice and microcephaly. Social history reveals that his mother worked in a child care center. The infant's vital signs are temperature of 37.0 degrees Celsius, blood pressure of 75/40 millimeters of mercury, heart rate of 150 beats per minute and respiratory rate of 40 cycles per minute. Oxygen saturation is 99% in room A. Physical examination reveals hepatosplenomegaly. CT scan shows ventriculomegaly, cerebellar hypoplasia, and periventricular hyperdense calcification. Brain MRI shows ventriculomegaly and hyperintensity of the periventricular white matter, as displayed in the image on your right hand side. Which of the following diseases contracted during pregnancy is the most likely cause of this patient's condition? A. CMV infection. B. Rubella. C. Varicella. D. Toxoplasmosis. And E. Syphilis. The time starts now.
A, CMV infection.
A. CMV infection. Is that your final answer?
Yes.
Okay, cytomegalo. Okay. That's correct. You have 5 points. So the next is Lasumsa. Please pick your question.
Question 4.
Question 4. A 47-year-old woman presents to the emergency department with complaints of right upper quadrant abdominal pain and nausea for the past 2 days. The pain radiates to her back and is getting more severe. She gives a history of multiple similar pain episodes after eating fatty meals that dissolved on their own within a couple of hours. She drinks only occasionally and has a 15-pack year smoking history. Temperature was 39.5 degrees Celsius. The heart rate 121 beats per minute. Respiratory rate of 16 cycles per minute. And blood pressure of 121/71 millimeters of mercury. On examination, she has tenderness in the right upper quadrant and epigastrium with guarding. Bowel sounds are hypoactive. Laboratory results shows elevated transaminases, and complete blood count shows white blood cell of 13,400, hemoglobin of 11.0, hematocrit of 33, platelet count was normal. The differentials were as follows: neutrophils 80%, lymphocytes 15%, monocytes 5%, erythrocyte sedimentation rate of 45 millimeters per hour, and C-reactive protein of 9.9. What is the next best step in managing this patient? A. Magnetic resonance cholangiopancreatography. B. Upright abdominal X-ray. C. Abdominal ultrasound. D. Upper GI endoscopy. And E. Cholecystography. The time starts now.
A for apple.
A for apple. Is that your final answer?
Yes, sir.
A for apple. That's wrong. The answer is abdominal ultrasound scan. You have 0 points, Lasumsa. So, Calabar, pick your question.
That is dotted.
Question 4.
Question 4 has been answered.
Question 5.
Question 5.
Question 5 the answer. It's dotted. It's not.
Question 5. A 30-year-old pregnant woman, gravida 1, para 0, at 22 weeks gestation, presents to the emergency department because her baby is not moving as much as before. She denies any pain or vaginal bleeding. Ultrasonography reveals no fetal cardiac activity or movement. The patient rests for an hour. The scan is repeated and shows the same findings. What is the most likely diagnosis? A. An embryonic pregnancy. B. Fetal death. C. Incomplete abortion. D. Embryonic demise. And E. Ectopic pregnancy. Your time starts now.
A for apple.
A for apple, an embryonic pregnancy. Is that your final answer?
Yes.
Yes, A.
An embryonic pregnancy is wrong. Fetal death, fetal demise or fetal death is the right answer. So you have 0 points, Komsa. So we've come to the end of the clinical section. Please, the timekeeper, the score recorder, please, let's have the
Yes.
scores, after which you collate all the scores. Let's have the final scores. Thank you.
Okay, thank you, Quizmaster. So the scores for the clinical round, Ahmadu Bello University scored 0 on the first round, 5 on the second round, total of 5. Calabar University scored 5 on the first round, 0 on the second round, total of 5. Kabale University scored 5 on the first round, 5 on the second round, total of 10. Lagos State University scored 5 on the first round, 0 on the second round, total of 5. Olabisi Onabanjo University scored 5 on the first round, 0 on the second round, total of 5. Tamsa Souza scored 0 on the first round, 5 on the second round, total of 5. So going to the total scores of each university, Ahmadu Bello University scored total of 25 points. Calabar University scored total of 15 points. Kabale University scored total of 40 points.
40,
Lagos
no, not
State-
40, not 40. Not 40, not 40.
Not 40,
Not 40,
not
not 40.
Please allow the score recorder to give us the scores. After that, I have my own score. Then we just allow her to finish. Thank you.
Okay.
Kabale University.
Kabara University scored total of 40 points. Lagos State University scored total of 30 points. Olabisi Onabanjo University scored total of 20 points. Tamsa Souza scored total of 30 points. That's all.
Tamsa is how many?
Tamsa Souza total of 30 points.
30 points. Okay. So somebody was saying that the scores were not correct. What's the problem with the scores? I will let me unshare my screen now. So that I will see the scores that are. So who was saying that the scores were not correct? Let me have your own scores. Please unmute yourself and speak.
Yes, the Kumsa scores are not 40 because on the last round of clinical, the second question they missed it and they got 0. That makes them to have a total of 35 points, not 40.
Sorry.
May I
Continue.
Yeah, that is my concern.
Which of the questions did Kumsa fail? Did Kumsa fail any question in the clinical rounds?
Yes,
I don't think.
did.
First or
The
second
second
round?
No, we did not. We didn't fail any question. No.
Kumsa, I didn't ask you. I didn't ask you, Kumsa. Mute yourself. Tamsa, did Kumsa fail any question, first or second round? Was it first or second round?
It's the second.
It's the second round.
Kabale.
That's actually not,
Yes.
that's actually not true.
Let's see.
Any other school, did any other school observe that? Because from my end, Kumsa didn't fail any question. Did any other school observe that? Abumsa, Lasumsa, Calabar, OAU, OOU, did any other school observe that? Or was it only Tamsa that saw that Calabar failed, that Kumsa failed one question?
Kumsa did not fill any question. They got to their questions correct.
Okay, thank you very much. Is there any other school? Because from my end, Kumsa did not fail any question. Like I told you before, I have my own record, and I know that other schools also have their own record. So Tamsa, Susa, perhaps when they were answering their last question, maybe you didn't pay attention. They got the question correct. So we've come to the end of.
Okay. I think I confused between the Kumsa with C and the Kumsa with K.
Okay, yeah. Kumsa with C is
sorry.
from Calabar, Nigeria, while Kumsa with K is Kabali from Uganda. So,
Thank you then. Then that's settled.
All right, thank you very much. So,
Sir.
Does anybody have a concern?
Yes. And just for the record, I mean, it's not going to affect the score, but we had a total of 20 points, not 15 points, just for the record.
Just give me a second. Let me go through the records again. In the general knowledge, Kumsa Calabar got 5 points. In math and logic, Kumsa Calabar got 0 points. In preclinicals, Kumsa Calabar got 10 points. And in clinicals, they got 5 points. So that's a total of 20 points. So does any other school have any problem with their scores? Does any other school have any problem with their scores? Okay, so I'll be handing over the mic now to Wahida, who is the SCOMA chairperson, as we've already had our winners for today. So Wahida, over to you. Thank you very much.
Much, doctors, for the wonderful work, and congratulations, and thank you so much all the rest of the team, the timekeeper, the moderator, and also the monitoring officers, without forgetting our beloved timekeeper. So I think now it's the end of our 4 rounds, which is general knowledge, preclinical, clinical, and math and logic, and we already have. Can you please, score recorder, brief me again about the scores, because I see there were a lot of contradictions. So now I think you have already correct everything. So can you please finalize the score for all of us?
Okay.
Hello, ma.
So the total score, Ahmadu Bello University scored total of 25 points. Calabar University scored total of 20 points. Kabale University scored total of 40 points. Lagos State University scored total of 30 points. Olabisi Onabanjo University scored total of 20 points. Tamsa Suza scored total of 30 points. That's all.
Okay, so our first 3 university is?
So the first university is Kabale University with 40 points. The second one is a tie between Lagos State University with 30 points and Tamsa Suza with 30 points.
Okay. So as long as we need 3 winners for this quiz competition, so Kabale University is our winner for our 2025 Inter-MSA quiz competition, we are announced, and Lagos State University is our first runner and Tamsa Souza is our second runner. With your permission, Dr. Samuel, as our quiz master of today, and as you are representing LECTURIO here today, let's allow me to announce and say like our winner of today is Lagos, and what the second one I forgot, sorry, is Lagos University, Lagos State University, and Tamsa Souza. So by that mark the end of our quiz competition of our final round. Now I'm going to leave the mic to Dr. Samuel if he has anything to say to us before we end the session. Thank you.
Okay, thank you very much, Wahida. So, sorry, score recorder, you say Lagos State University got how many points? Score recorder. Score recorder, can you hear me? Score recorder, can you hear me? Wahida, can you hear me?
Yeah, she said 30 points.
Then Tamsa Souza got how many points? Sorry? Tamsa Souza got how many?
30.
30 or 35? 30. Okay, so that means there is a tie between Lagos and Tamsa. And since this is the final, there is the prize for the second position is different from the prize for the third position. So I think it will be necessary if we do a tiebreaker for them so that we'll have the second position and the third position. Right?
Yeah, exactly.
Okay,
Yes, it's so.
Yeah, thank you very much. So, sorry?
Well, to make it good, and I think math and logic hit different.
Sure, that's what we're going to use. That's what we normally use for tiebreaker. It's the math and logic that we use. So I'll be sharing my screen now, and I'll be displaying the math and logic question. Okay. Can you see my screen now? Can you see my screen?
Yes, we are seeing it.
Okay. Just remember that some of the questions here have been picked before now. So as soon as you pick question that have been picked before, we'll ask you to change the question. Is that correct? Is that clear? So we have Lasumsa and Tamsa Souza. It's going to be 2 rounds, so you are picking 2 questions each, the first round and the second round. For the first round, we are starting with Lasumsa, then Tamsa. Second round, Tamsa, then Lasumsa. So Lasumsa, please pick your question.
Question 28.
Question 28. Philosophers are, I think this question has been picked. Pick another question. Somebody picked the question before.
Okay. Question 16.
Question 16. Describe the following sequence in mathematical terms. 144, 72, 36, 18, 9.
Descending geometric sequence.
Descending geometric sequence. Is that your final answer?
Yes.
Okay. Our timekeeper, I hope you are there. So the descending geometric sequence is correct. You have 5 points. That's Sumsa. Tamsa, Susan, please pick your question.
28.
Question 28. Sorry, 28.
Yes.
Yeah?
28.
28 has been picked. Why is everybody picking this 28?
Okay, 29.
29.
Yes.
Function of educational structure is, this question has been picked. Pick another question.
Okay, 30.
Question 30.
30.
A 3-digit number. My 10th digit is 5 more than my 1st digit. And my 100th digit is 8 less than my 10th digit. What number am I? Your time starts now. You have 15 seconds.
Okay. This one. Okay, 194.
134.
194.
194. Is that your final
Yes.
answer?
194, yes.
194 is very correct. You have 5 points, Tamsa. Okay. Lasumsa. Please, okay, Tamsa, pick your second question for the second round.
34.
34.
Yeah.
A certain fishing boat is chartered by 4 people. This question has been picked before. Please pick another
Yeah.
question.
What about, sorry, can you pronounce or mention the name,
No.
letter
I
F?
don't. I don't actually know the question that have been picked. But once I read the
Okay.
question, I will remember whether it has been picked or not.
What about 26?
Sorry?
26.
26.
Yes.
Using Holiday Sega formula, calculate daily maintenance fluid for a 22 kg child. Your time starts now. Using the Sega formula.
Okay. Okay. 1,540 mils. 1,540 mils.
Your final answer.
Yes.
That's correct. You have 5 points, Tamsa. Lasumsa, please pick your last question.
Question 22.
Question 22. Kaveri walks 18 kilometers towards north. From there, she walks 6 kilometers towards south. Then she walks 9 kilometers towards east. How far and in which direction is she with reference to her starting point? Your time starts now. You have 15 seconds.
Fifteen kilometers northeast.
15 kilometers northeast. That's very correct. You have 5 points, Masumsa. Okay. We'll go over to general knowledge. Let me share the question for general knowledge. We also go 2 rounds for general knowledge. Since at the end of the maths and logic, Lasumsa has 10 points and Tamsa also have 10 points. So we'll quickly go over to general knowledge. We are picking two questions each. Can you see my screen now? Can you all see my screen?
Yes,
Huh?
yes, yes.
Okay, so for this time we'll start with Kumsa. So Kumsa, you will pick question followed by Lasumsa, then Lasumsa followed by Kumsa. Sorry, I said Kumsa, Tamsa, sorry. So Tamsa, you pick your question.
Question number 6.
Number 6. Who this question has been picked? Pick another question.
Okay. Question number 11.
Question 11. Which laws explain why aeroplanes can fly? There are 2 laws. So what are they? Sorry?
Bernoulli principle, Bernoulli principle, Bernoulli principle, and the Newton third law. Bernoulli principle and the Newton third law of motion.
Okay, that's
Bernoulli principle and the Newton
correct.
third law of motion. Yes, thank you.
That's correct. You have 5 points, thumbs up. Lasumsa, pick your question.
Question 22.
Which metal was historically known as quicksilver?
Mercury.
Is that your final answer?
Yes.
Yeah, I think so. Mercury is correct. You have 5 points. Lasumsa. Okay, Tamsa. Lasumsa, pick your question, your last question for this round.
Question 24.
The skull bones and cross. This question has been picked. Sorry.
Question 16.
Who coined the term survivor of the fittest?
John Lamarck. Jean
Is that your
Lamarck.
final answer?
Yes.
No.
Timekeeper, hope you are there.
About
Albert Spencer is our final answer.
Timekeeper, did they answer within time?
Did they say the second question, the second answer?
Yes, the second answer, did they answer it within time?
No.
Okay. So, Lasumsa, 0 points for that. Okay. The answer is about Spencer, but you said it after time. The time was already up before you said it. Sorry about that. Tamsa, pick your last question.
Question 14.
But sorry, even Lasumsa,
14.
Lasumsa, let me even see your faces. Where are they? Where is Lasumsa? I cannot see Lasumsa here.
We are very visible. I think it's from your side.
Okay, I can see you now. Okay, it's fine. Was this how you were when you answered the question?
Yes.
Because the change in the answer was even shocking to me, from Jane Lamarck to Spencer. So shocking to me, but it is what it is. I believe that the team that are monitoring the cameras are there, so it's well. So Tamsa, please pick your question. Can you still see my screen?
Yeah. Question number 14, 1-4. Am I audible?
Question number 14.
Yes.
Can you see my screen?
Yes, we can see it.
What is the name of the regional director of WHO?
The question is not displayed in here.
Sorry?
We don't see the question. We just only see the numbers.
Sorry.
Yes.
Can you see my screen now?
It's loading. Okay, yeah.
So pick
Now
another
we
question.
can see.
Pick another question.
Another question.
Okay.
Cannot hear you.
So,
number 34.
34.
Question 34.
Question number 34.
The third person, the guy, I cannot see your face completely. Yes, I can see you now. Thank you. Question 34.
Thank you.
Yes.
Which African president was elected by winning over 97% on general election?
President Samia. Yeah, it's
Oh.
97.
Yeah.
I remember.
Yeah. Correct. You have 5 points. So
Tanzania, oh yeah.
we've come to the end of today's competition.
Sir, am I audible?
Yes.
Okay, so I don't know if TAMSA were being monitored, but like a lot of times during the quiz,
They were looking up.
they were
and
looking
and the
upwards.
girl in the
There
middle
was
had
even a
the
point
phone.
where someone had a phone. And even like in this particular tiebreaker, like when you read this last round now, when you read the last question, the girl was looking upward
The
again
girl
before you
needed to
asked them to
decide,
do.
and the guy has been looking up. We've been noticing that since normal clinicals and preclinicals. So I don't know if the monitoring team has been checking that out.
The monitoring team, are you still there? Monitoring team, are you there?
Yes, we are here.
So
Yes.
is that true?
I don't think. Why you're saying that now while we are monitoring it? I don't know, maybe we can confirm it to Mari, our score recorder, and also we can confirm to the timekeeper is not here anymore. I'm here with Dr. Samuel and Mari. So Mary, can you please confirm? Score recorder.
Sorry, I assume it was being recorded.
And if the timekeeper wasn't here, like he didn't even say anything about our time up or anything. So that about Spencer's question.
No, I actually for that
present.
particular Spencer question, I actually had times up before you pronounce it.
Including time.
I actually heard it, but I wanted to know whether the timekeeper heard the same thing with me, because if timekeeper heard your question first, I would have gone with the timekeeper. But he also heard it the same time that I heard it. He said time's up before dispenser. I actually heard it. You can check that on YouTube. I think it's being recorded. But this last question, the reason why I laughed was, is their country. They just finished election. It was even because of the election that this quiz was postponed. It was supposed to be last 2 weeks, I'll be last week. So that was why I laughed when I heard the question. So I don't, and for the fact that you didn't mention this about monitoring before now, because once I'm sharing my screen, I cannot see your faces. That's why. So, and I believe that the monitoring team since the beginning of this quiz has been doing a very good job. So you should have mentioned it the very first time you noticed it in the quiz. But for this particular question, it's a question that they are not even supposed to fail. It's their country. It's just like asking you in Lagos State, the president of Nigeria. You cannot fail that one. Even if you look down or look up, you can still not fail
Kwa hiyo
it.
tuchague
Nasumsa, can you hear me?
Yeah.
tukasave, halafu
Can you hear me?
tukatazama sehemu
Sir,
nyingine.
don't
Yeah,
make the
yeah, yeah.
monitoring teams
We can
confirm on
we
YouTube.
can hear
Everyone's
you.
with our phone. That's what we're not talking about.
Like
This their
throughout the
question.
quiz, there have been like very
I
suspicious
don't know if they can,
movements from them.
if other schools are still
Kama
around.
una basi tujue.
Yeah,
Kumsa, are you
Basi
still there?
vingine
Kabale University, are you still there?
Yes, we are there.
Yes, we are still there. Follow
Is
it.
it
Follow it.
what Lasumsa is saying, is that true? Did you observe that also?
No, we didn't.
We didn't recognize anything of that.
Okay.
Huh?
So
She didn't.
it's okay. So we've come to the end of today's quiz.
Confirm it live on YouTube. Wait. There was a clear evidence that she was with her phone.
Lasumsa, the problem at this point is this is a tiebreaker. This is a tiebreaker. You should have mentioned this when the final score was announced. That was when we would have come. So if you go back now and you wait, are you the phone ringing? Is it in this tiebreaker?
No, it was not.
Exactly, that's the problem. If it was in the tiebreaker, that's where, okay, if you go and confirm it now, and it now result that the score below a particular school have been eliminated, what do you want to do? You want to cancel the quiz and do it again? So you said it at the wrong time. And Tamsa, please, anyway, there's no need to say please, because next year is still coming and it is going to be stated. But at this point, it was actually said very late. So had it been, it was in this tiebreaker that you observed that, we'll go and check and then we'll take our action. But the quiz is we've already come to the end of the quiz before you said it. So it will actually going to distort a lot of things. You should have said it earlier. So we've come to the end of today's quiz. And the winner of the quiz is Kabale University with a total of 40 points. Then Tamsa Suza, the second and third, Lagos State University Medical Student Association. So congratulations, everyone. Like I said during the orientation, at the end of the quiz, we are only coming up with just one winner because for the quiz to end, one person must emerge as a winner. So, but just know that at the end, everybody is a winner. Whether you are among the first three or you are not among the first three, everybody is a winner. So at the LECTURIO FAMSA Quiz Pan-African competition is a yearly competition. So by next year, we'll be glad to have you for most of you that are still that will still be in school by then. Then for those that will not be in school by then, you can always support your schools on YouTube because it's actually streamed. If you go on YouTube, you'll be seeing the comments and everything. So I think that's all from my end. So Kabale University, congratulations once again. You've actually done very well. So that's all from my end. My name still remains Dr. Samuel Igwe Jideofor. I'm a medical doctor here in Nigeria, and I'm the director of LECTURIO Student Partnerships in Africa. So the reason why we decided to use the preclinical and to use our platform for the preclinical and the clinical section is for most of you to see what I was explaining during the orientation. Because I told you can generate as many questions as possible, which you also, the way I did it, I generated the questions, and you can also generate that for your study groups and everything, including for your school quizzes, provided you have access to the platform. Then you can always reach out to me, can ask Wahida for my contacts in case you have anything to discuss with me. So at this juncture, I will be handing over the microphone to Wahida. So thank you very much for having me. It's a pleasure from my end. It's also an honor to be the quiz master of 2025 FAMSA Pan-African Quiz Competition, the grand finale. So goodbye, everyone, and have a wonderful day.
Okay, thank you so much, Dr. Samuel, for your support, for coming here, staying here with us, and for being our quiz master from the beginning till the end. In our final round of today, we thank you so much, and also I thank the organizing team, the FAMSA Scoma team, and the LECTURIO as well, by bringing this into the table and bring this to medical students across Africa. Thank you so much for that. And also I want to thank all medical students associated in this quiz competition. So it's a good number, it's a pretty number, but in the next year we hope we will have a lot of medical students association, more than 40 or about 50. We know in Africa there is a lot of medical students, so we hope we can get a lot of medical students who are going to attend this opportunity. And congratulations to those who win the quiz, and for all of you who've been in the final rounds. It's a pleasure to have you today, and congratulations, Kabale University, and also the LASUMSA and DAMSA. Congratulations to you. You really did a great job, and may Allah subhanahu wa ta'ala bless you. Please keep it up. The work that you have done, we need to see it in the next year too. We need to see you in the other university who are not here today, to see them, they are becoming a winners too, as you are now. And by that, on my side, that's make the end of our inter-MSA quiz competition 2026 between FAMSA and LECTURIO. So thank you so much for having me. My name is Wahida, as Wahed in Arabic is Wahida. So you can just call me Wahida Ali. Thank you so much. See you in the future.
Thanks, Wahida.
Yes, you're welcome. Dr.